We're looking for our daughter, Myra Adams.
Our son called. Is she all right?
Come with me, please. Dr. Manning, Dr. Choi. These are Myra's parents.
What happened? We talked to her 2 days ago. She was fine.
Myra? Myra, honey. Oh, please, I'd like to see her.
Yes, of course. Please.
What's going on?
I don't know.
My poor baby. Myra? Honey? We're here.
What's wrong with her?
We don't know yet. She collapsed in the bathroom and has regained consciousness.
We don't think it's a brain injury. Myra's CT scans were clear.
Last month, her friends brought her into the ED. Could that have something to do with this?
Honey, that doctor said she was just dehydrated. She got an IV. She was fine.
We checked her chart. Back then, Myra's tox screen and blood work was normal, except she was slightly anemic. Same as now. Is she vegetarian?
Vegan, as long as I can remember.
Never liked meat.
Well, that would explain the anemia. Is there anything else you can tell us?
What?
No, it's just, it was finals week, so she wasn't really, like, eating or sleeping much at all.
She always works so hard. I tell her all the time she needs to rest.
How do you know all that?
I've been staying with her.
Since when?
Myra?
She's tachycardic and tachypneic.
That means her heart is racing and she's having trouble breathing. We need to intubate her.
Please let the doctors help her, okay?
Come on, baby.
Please.
Oh, God.
Let's get an EEG and LP, and antibiotics and antiviral just in case. Gram of ceftriaxone, 500 milligrams acyclovir.
Why is this happening? Why?
Myra's lumbar puncture was negative. There's no infection. However, her EEG was positive for seizures. We've put her on Ativan, but unfortunately, they haven't subsided.
Myra's always been so healthy. I just don't understand.
But the Ativan, it'll work, right?
Well, we're gonna do an MRI, get a closer look at her brain, see if there's something that the CT didn't pick up.
What's happening?
She's posturing again. I'm afraid whatever's going on in her brain is getting worse.
Her pupils are sluggish. Bolus another 5 milligrams of Ativan on top of the drip and get her up to MRI, quickly.
Hey, can I go with her?
Sure.
No. Eric, you stay with us.
I'm gonna order an echo check for heart vegetations.
You're thinking sepsis, but her white blood cell count was totally normal.
Everything was normal the last time she was here, too, but she's back even worse than before.
Ethan, these 2 ED visits could be totally unrelated.
No, I think they missed something last time.
Missed what?
I don't know.
Yes.
We think we know what might have caused this.
Eric, Myra got sick while he was staying with her.
We never wanted him around our daughter.
He's a bad influence. He never applied himself. He's the opposite of
No
Myra.
job, hangs out with a bunch of deadbeats.
We kicked him out because he was stealing from us. He takes drugs.
I'm sorry. I'm not following.
He probably slipped her something. A drug of some sort.
There's no evidence of that.
Well, are you sure? Because if you knew what it was...
I understand, but this is a very difficult time. But the best thing we can do right now is wait for the MRI to come back. And I promise, as soon as we hear anything, you will be the first to know. Okay?
All right. I don't understand. What are you saying?
We did what's called a nuclear blood flow study, and it showed no circulation to her brain.
Well, there must be some other tests you can run.
They've all been negative.
Or something else you can do.
I'm sorry. There isn't.
We've done everything we can, but unfortunately, your daughter is brain dead.
No. Okay.
Our little girl.
I'm so sorry.
No. She's gonna wake up. She's gonna be fine. Myra? Honey? Myra.
She's gone, sweetie. Your little girl's gone.
We'll give you some time with her.
Oh, baby. Oh, baby. Oh.
Excuse me.
Mr. Adams.
Our daughter was always doing things for other people. She told us if anything ever happened to her, she wanted to donate her organs.
Of course. We'll get that started.
We want her life to have meant something.
We understand.
Thank you.
Of course.
You're high. Look at you. You're high. Your sister's dead and you're high.
But Myra's, she's dead?
This is your fault, isn't it? You did this.
See? I told you he is no good. He is a drug addict.
What did you give her?
Nothing?
We told you, Myra's tox screen was negative.
You worthless piece of...
Whoa.
Get out. Get out!
Eric. Hey, listen, the last thing that I need right now is a lecture.
Hey, I'm here for me as much as I am for you. What happened back there? Sometimes when people are grieving, they lash out.
Yeah, no, that's how my folks always are. Man, they think I'm worthless. I don't know. You know, maybe I am, but they think I want to be like this, and I really don't. You know, Myra, she was the only one who ever like really saw me. You know?
Yeah.
And now it's.
What do you want, Eric?
I want to get clean. You know, I want to like wake up and just feel clear.
Okay. Let's set you up with a social worker, get you in a program.
Was this so seriously?
Yeah. You'll get the support you need, but it's up to you to come through.
Why are you doing this for me?
I guess I'm seeing that there's a difference between a crutch and a helping hand.
Thank you.
Yeah. Let's get you something to eat first, huh? Help you come down.
No, I had a burger earlier. It made me like feel really sick. That's why I had to get high. You know, not to feel it.
Maybe food poisoning?
No, I just felt crappy. Like I always do.
Always or just after eating?
A metabolic disorder caused her death?
The precise term is ornithine transcarbamylase deficiency, or OTC. You see, Myra's liver was missing a vital enzyme that helps break down protein.
Something as simple as eating a burger could cause toxic levels of ammonia to build up in her blood and attack her nervous system.
But Myra was a vegan.
Which is how she was able to avoid symptoms for so long. But when she pushed herself and didn't eat, finals, the fellowship, her body started breaking down muscle, which released protein into her blood.
So you mean she'd be alive right now if she'd just eaten?
If this disease is genetic, that means one of us gave it to her.
Yes, it is passed through the X chromosome from mother to child. But
OTC sufferers exhibit totally normal liver function. That's why all of Myra's tests came back clean.
yeah, we were only able to diagnose her once Eric explained his lethargy and sickness after eating. We believe he has the defect as well and has been self-medicating with drugs.
Eric? Is this true?
I'm so sorry.
Oh, son.
Will you forgive us? Will you forgive us?
We're so sorry. Oh, Eric.